Hi, so my name is Zoe, and today I will be completing the patient education assignments. So I received prompt number 16. It was about a 7-year-old man who has osteoarthritis of the hip. He has pain at the knee as well. His muscle strength MMTs was 3 out of 5 at the hip, 4 out of 5 at the knee, and he has trouble walking and an obvious limp. So if I were to educate this patient, I would begin by describing the anatomy of the hip. So the hip is a ball and socket joint. The ball would be the head of the femur, and this articulates with the acetabulum of the pelvis. So in a healthy joint of the hip, there is a synovial liquid or fluid, and there should be a nice space in there. And so what happens when you have osteoarthritis is the degeneration of the cartilage that happens over time. It will decrease this space. So the cartilage will begin to wear off, and the bone will compensate by creating osteophytes. So this is like little spurs on the bone, and this is making up for the cartilage that's not there. And as a result, the space in the joint will reduce. So this will also increase the pain. So yes, the cartilage becomes rough and frayed, and the synovial, the synovium on the cartilage is worn off, and this synovium is responsible for creating synovial fluid. So when the synovium wears off, there's also less fluid, so the articulation is more painful, of course. So the risk factors, there is no specific mechanism of injury for osteoarthritis, but there are risk factors. So the main one is age. As you get older, there's higher risks of developing osteoarthritis. As well, another risk factor is obesity. This is just because there's a greater loading force on the joints, so the wear and tear will develop more quickly. Another one is menopause. So when women go through menopause, their levels of estrogen decrease, and normally the estrogen is responsible for protecting the cartilage against inflammation. So the degeneration of the cartilage will happen more easily. As well, other risk factors are previous injuries, your occupation. So if you have an occupation where there's a lot of constant force in a joint, this could increase your risk, as well as factors such as congenital deformation. So this means when you have a deformation at birth. So what causes the pain of the arthritis? Generally, it's because there's bone on bone rubbing, so the articulation wouldn't be smooth anymore. As well, the cartilage is wearing off, so it's becoming inflamed. And when something is inflamed, there could be swelling as well, and this will put pressure on the nerves around the joint. Also another reason for pain is that the protective space in the joint is decreased. So this will add more pressure in there and put more pressure on the surrounding structures and nerves. As for the treatment of osteoarthritis, there's things that could help, such as losing weight. So if the client is obese, then losing weight would of course help. As well, it would be good to strengthen the muscles around the joints. So what could happen if the muscles are too weak? The joint won't be properly supported on both sides, and this could cause extra movement in the joint. And most of the time, when someone has osteoarthritis and there's pain, they will stop moving as much, so their range of motion becomes decreased. And as a result of less movement around that joint, their muscles start to decrease in strength. So, of course, strengthening and increasing range of motion would be ideal, as well as you could increase your flexibility around the joint. So what could happen is if they have really tight muscles around the joint, this would put more pressure in the joint. It could be the ligaments as well around the joint that are very tight. So when you increase your flexibility, it will relieve the pressure of the head of the femur on the acetabulum, and it should make that protective space increased. It should increase that protective space. And as well, you should improve your proprioception, and this will just happen with increasing your range of motion. And they also need to improve their balance, because at the moment they can't stand on one leg for longer than 2 seconds. So by doing these proprioceptive exercises, like working on their balance and other exercises as well, this will help with their pain, because there will be a better mind-muscle connection. And when they go into that painful motion, their muscles will know how to react. And since they have a better strength as well, they will kick the joint back into place. And lastly, as a few functional movements, walking would be the best one, because they need to improve this for their everyday living. And if they want to get creative, they can start swimming if that's something that interests them, because swimming reduces a lot of pressure on the joints, so it would be really an ideal exercise. Thank you.